these days, in every hematology meeting, the greatest excitement is about the use of autologous CAR T cells, whether in lymphoma, non-Hodgkin lymphoma, or acute lymphoblastic leukemia, or multiple myeloma. However, there are still patients who are receiving and can benefit from high-dose chemotherapy and autologous stem cell transplantation. And for decades, the standard of care for high-dose chemotherapy and conditioning prior to autologous stem cell transplantation in myeloma is the famous BEAM regimen. So here we are presenting at ASH 2019 a multi-center prospective study where we have replaced BCNUs, a B in BEAM, by Thiotepa in a regimen called TEAM, Thiotepa, Etoposide, RSC, and Melphalan. And what's really interesting is that in more than 100 patients tested prospectively, actually this regimen is feasible, is safe. Obviously, we have probably more mucositis, but it is proving, although it's not a randomized trial, it's proving that such regimen can be useful in those patients who have extramedullary disease or are at higher risk of relapse, especially because of the fact that Thiotepa can penetrate into the CNS. So definitely, obviously BEAM is still a standard of care, but the results of this study suggest clearly that one can safely and effectively use this kind of team regimens.